This podcast is for educational and informational purposes only. It should not be used to substitute the advice from your medical professional or primary care provider. If you are having any kind of medical issue or emergency, you should call 911 or go to your nearest emergency room, urgent care center, or consult with your doctor.
Welcome to Healthcare Snitches. Welcome to Healthcare Snitches.
Welcome, guys.
We've been going for a while.
But now we're back with the jump off.
Yeah, we've been going since
Kim.
when? November?
Well, it was after the election, so it had to be sometime in November or December was the last episode posted.
Okay. Oh, you gotta say your thing.
Yes, so just to remind you guys, nothing has changed. Please go follow us on Instagram, Facebook, TikTok, LinkedIn, MySpace, Black Planet.
Black People Meet.
Black people, no, we are not on there. But yes, like and subscribe, and can't forget YouTube. That's our main place. Please, we need more subscribers. The other day I noticed that I was posting the videos, but they weren't necessarily under podcast. So now they're under podcast as well as under our page. So they're in both places.
Okay. So you think it'll be easier for people to find it?
Yeah, because when you type in the search Healthcare Snitches, the first thing that pops up is the podcast. And there was only like 2 episodes popping up under there. So I added all, I think 19 or 20. How many episodes?
Probably 20, because I think we had our 20th celebration.
Mm-hmm.
So either 20 or 21. I don't know if the last one was the celebration. So I ate Domino's. My breath is stink. So if you
she always got something to say. I don't smell anything, by the way.
If you see Jasmine like, it's because I'm over here humming.
Yeah, you're not, but you might want to move over a little, just a tad bit, get a little closer. I don't care, and I don't smell anything.
Let me talk going this way like this.
I can't, don't do that.
So, Jasmine, do you want to take it over? Oh, I'm just a guest on her show today.
No, this is not the Jasmine Show by any means.
Jasmine Show today.
But today's topic is near and dear to my heart because the reason why we haven't recorded or that we've been absent is because in December, I unexpectedly found out that my teenage son is in end-stage renal failure or end-stage kidney disease. So in this episode, we're going to be talking about kidney disease. Send us kidneys, Lord, okay? Because that is what we need. So first half is going to be some education, basic education about kidney disease and some signs to look out for, symptoms, the different stages. And then the other half is really going to be about my personal experience and all the things that I have learned. We have this podcast, and I know a lot about a number of different healthcare topics, including kidney disease, because there was a point in time where I was helping to care for my father who was in kidney failure, and also just by the nature of what we do, we had worked with dialysis clinics before. I almost actually worked for a dialysis clinic at one point.
Oh, really?
Yeah, but I didn't do that because it would have required me to travel to different. It was actually DaVita. So they had reached out to me, and I was like, I don't really want to do that. But I have learned so much over the past few months, not only about kidneys and their function and kidney disease, but also, we talk about advocate for yourself, and we talk about advocate for yourself, the patient navigation and journey, but also caregiver fatigue. And I have experienced all 3 of those things first hand in the past few months, still going through it. But I'm on top of it. I'm not, look, when I tell you, they got the right one, baby, okay? Because can't stop, won't stop. Oh, we can't use his phrases, can we?
You probably shouldn't use his phrases. But it really did apply here.
Yeah, because I'm not playing about my child. I always, and now it's funny because I always made fun of the John Q thing where he's in the hospital. He's like, somebody go give my son a heart. Okay, that's how I feel right now because somebody's gonna give my child a kidney. All right. But unfortunately, it doesn't quite work like that. So you kind of have to go through a whole process in order to donate and get. It's a whole thing.
And Jasmine has been educating me too. Even though I'm a registered nurse, you know, if you don't work in a certain field or a certain area, you don't know much about it. I just knew enough to be able to keep my patients alive when I was working the floor in med-surg and to pass nursing school. And to get my job done when we were working together. That's it.
Yeah.
But you are like living in this CKD type of situation where you are just educating me. So many things I did not know that I wouldn't know unless I specialized in renal.
Yeah. So, you know, I have oftentimes asked myself throughout this process, why God? Like, why is this happening? But I'm trying to just be positive and learn as much as possible, actually, so that I can be the best that I can be for my son. So let's talk about kidneys. So everybody should have two kidneys. Some people are born with one, and you can actually survive with one, right? Yeah. So when people get a kidney transplant, they don't get two kidneys. They just get one. And one can pretty much maintain you and sustain you as if you had two. Not as if, but one healthy kidney is definitely just as good as the two. Like you will live with one kidney.
And you taught me that too, because I thought when you get a kidney transplant, you had to get two kidneys.
Really?
If it's two bad kidneys, yeah.
Oh, okay. Nope. You can live with one kidney. So even like the people that are born with one kidney, they get closely monitored throughout their life just to make sure that the one kidney is functioning at 100%. But they can live a completely normal life.
Did something really itch down there, or was my breath stinking? You had to duck.
My leg was itching.
Okay. All right. Just check.
I don't smell anything, girl, so I don't know what you're talking about. But also March is National Kidney Awareness Month. So that is also why we're doing this episode. It just happens to be also near and dear to my heart. And recording this podcast, like I said in one of our last episodes, is a source of kind of distraction for me. It is enjoyable because I'm doing it with my girl Kim. As you can see, she ain't moved nowhere, so
oh yeah,
we'll update on that. But I'm like, yes, girl, my little hocus pocus worked with the candle.
It did.
It worked, girl. God said no, she cannot leave you at this time, and it.
Yeah.
When I tell you,
I would have been leaving right when all that.
Yes.
Was happening. I would have been flying out.
Yes.
Well, driving down.
Whatever. You just would have been out.
Yeah.
I would have been even more in shambles.
You wouldn't have, because you were so occupied.
But just knowing
what was going on,
that you were there, okay?
You were so occupied. You would not have even noticed that I was gone.
I would have. You brought the girls food. You were there for me. I stopped by your house. You trust me.
I would have liked to have been on the scene, but that's a whole nother story.
It is, but it's okay. You were there in spirit. All right, so what the heck was I saying before that?
You talking about the kidneys?
Okay, So one could be enough for you, right? So some people are born with one kidney and they can function fine. They just make sure they monitor it, whatever. So one of the things that I never really realized, I knew the kidneys were responsible for filtering, right? Filtering out toxins. You know, I knew it had, it was part of the urinary tract system, including your ureters, your urethra, your bladder, all of that. And so for me, that's really what I thought of them as.
Extent of it.
That, and also I knew that in some way, shape, or form, they were impacted by diabetes and hypertension. But I didn't fully understand why, right? So through all of this, the centers that my son had to go to for dialysis really provided a ton of education to help you understand the function of the kidneys and why, someone at the point of getting dialysis needs it, right? Because you have to understand when you're at the point where you need dialysis, that acts as your kidneys.
Yeah.
So whatever your kidneys were doing or responsible for, now dialysis is doing that for you. Doing actually only part of it. The other parts are supplemented through different medications that have to be taken, and diet and lifestyle changes that have to be made, pretty much. So the kidneys are responsible for cleaning and filtering. So they're responsible when you eat food, when you drink drinks, right? Your body is very smart. That's also another thing I learned too through this whole thing. Like, your body is so freaking smart. God is amazing. Like, it knows exactly what to do. So all of the minerals, vitamins, and the nutrients that you take in through your food, your body will absorb what it needs, and it will filter out what it doesn't need. So any additional, magnesium, phosphorus, calcium, most of these things you'll either pee them out, or they'll be excreted in some other way, right? So responsible for cleaning and filtering from the foods that you eat. Any toxins that are in your body are filtered through the nephrons, and this is happening 24/7. So as you're going throughout your day, your kidneys are working. There's two of them. They know what to do. It happens. There's no question about it. Just the same as your heart and everything else that's working in your body. You don't really think about it, but it's happening all throughout the day. It's responsible for removing excess fluid. So you drink a lot of water throughout the day, you go to the bathroom a lot, right? That's how you know everything is flowing through, it's working. Anything that you take in, once you drink, it flows throughout your entire body. You pee out what you don't need. Anything that's extra. One thing that I was very surprised at, and I had no clue, was that it helps make red blood cells. So there's a specific, I think, either protein or enzyme that is responsible for creating, that helps deliver the oxygen from the lungs to your organs. So when Kim was always talking about your organs perfusing, it is critical in that.
One organ can stop the show.
One organ can absolutely stop the show, because once one organ stops working, all your other organs start to overcompensate for it. That's a different story. But so what happens when the kidneys aren't working correctly, if it's supposed to be helping to create the red blood cells, is that you become anemic, to the point where, honestly, once we did get my son to the ER and they did all his blood work, his hemoglobin was 6.6. He needed a blood transfusion. So it is critical. It really is. And finally, it helps activate vitamin D. So any vitamin D that your body takes in, it helps to properly absorb it, and keep your bones strong and keep your phosphorus balanced. Child, when I tell you, I have never cared about phosphorus more or ever than I do now. Okay, Flintstones. Okay, that's what I think of when I hear the word phosphorus. A dinosaur, bones in a museum. I'm like, yeah, who cares? When I tell you, again, we don't think about any of this, because if everything's working correctly, we're just going about our lives. We're doing all kind of wild, crazy stuff. And our bodies just know what to do. But the moment something stops working is when you realize, just like when your nose is stuffed and you're like, damn, I remember when I could breathe. You're like, damn, I never wanted to breathe so bad.
But you never pay any mind when you're breathing normal.
Right. It's just like that. So when we got into the mode of, okay, he's in kidney failure, phosphorus is out of whack, potassium, magnesium, all of these electrolytes are all over the place. The kidneys are responsible for keeping these all in balance, because it's filtering everything out, keeping what you need, keeping it in balance, and everything else. It's like a Brita filter, pretty much, for your body. So what happens when your kidneys aren't working properly? Toxins build up in your system, fluid builds up in your system, your kidneys start to become damaged. They may even start to shrink down.
And these toxins are going to come out no matter what.
Yeah. So the toxins will be throughout your entire body. It can cause mental confusion, headaches, nausea, vomiting. There's something, uremia, which builds up. That causes a lot. It causes your breath to smell like ammonia. Tons of these things. So those are the common things that happen when your kidneys are not working. But how does this kind of display outwardly? So the tricky thing about kidney disease is that tons of people are walking around with it in some stage, and they don't know they have it. Undiagnosed. They have no clue that they have it.
And it's really common.
Yeah, because there are 5 stages of chronic kidney disease. So you'll hear us refer to that as CKD, because I'm not saying that all the time.
That's too many syllables.
Right. But before we get to that, some causes of kidney disease are high blood pressure or hypertension, same thing. Well, actually not the same thing, but either one. Diabetes, autoimmune diseases like lupus, rheumatoid arthritis, or scleroderma, whatever that is, can cause it as well. Genetic disorders, the use of IV contrast dyes can also cause kidney disease. UTIs or other infections. I heard a lot of people after they had COVID ended up coming down with kidney damage or being in kidney failure. But one thing to note is that 2 out of 3 CKD cases are caused by hypertension and diabetes.
That's crazy.
So that should tell you all something, because a lot of times hypertension and diabetes are preventable, especially if it's type 2 diabetes. And with hypertension, a lot of times that is caused by lifestyle. But sometimes it's not. Sometimes your blood pressure just happens for whatever reason. I don't know. You would know better than me.
No, you actually are saying it right.
Okay. All right.
I mean, there are some things that can cause hypertension. But...
Right. Like, for example, in the case of my son, the kidneys are also responsible for regulating your blood pressure. So if they are damaged, and if you are in the end or the later stages of kidney failure, it will cause your blood pressure to be elevated. So that was actually one of the first signs of that something was wrong with him, because there was really no other signs. It was like one other, but the 2 others. The vomiting.
And the vomiting.
Yeah. So when you have chronic kidney disease, or CKD, there are 5 stages. And the 5 stages are based on your level of kidney function. So they get to that level by a lab test called a GFR. And that is can you say that word? Glomerular filtration rate. You might see it referred to as eGFR, which is an estimated glomerular filtration rate, or just GFR. But either way, for a normal rate, it is greater than 90. When you start getting into stage 1 and stage 2, it's 60 or less, right? So starting at 60, it may indicate slight kidney damage. Now, I will say this: there is chronic kidney failure and there is acute kidney failure or acute kidney injury. Chronic means that it is something that cannot be reversed. It is usually caused by diabetes or hypertension, and it will progress to a later stage at some point if you do not take certain interventions to stop it from doing so. Acute can mean that something happened to you where either you injured it physically, your kidneys, or you took some type of medication that caused some temporary injury to your kidneys that you need to fix now, either with a medication or by having dialysis for a short period of time to get your kidney function back up to par. Now, I will say that when we first started doing, is your mic on? Mm-hmm. When we first started, because you know your mic don't be on sometimes. When we first took my son to the ER, we weren't sure if his kidney issues were chronic or acute. And so I was just praying that it was acute. I was like, because then we just get the dialysis real quick and we move on with our lives. Unfortunately, they are not. So we'll get to that later. So stage 1 and stage 2 is 60, between 60 and 30. Am I reading that right? No, I'm not reading that right. Sorry. It's 60 and below. Well, I'll get to the rest. And people at stage 1 and 2 usually have no symptoms, right? It would just be happenstance that if you're going to your doctor and they do run the labs that have this, which they should, they'll see that and they should tell you at that point, because then you can take precautions like making adjustments to your diet, like reduction in protein, drinking more water, things like that to help, improve your kidney function, maybe some supplements or something, I don't know. But at that stage, you could probably either prolong it from progressing to a greater stage or stabilize it, keep it at that stage, right? When we look at stage 3, your GFR will be between 30 and 59. 3A is between 45 and 59, and 3B is between 30 and 44. So as you can see, they break it down even further into A's and B's within the stages, because I guess it's getting gritty there. But this is a moderate loss of kidney function. Again, many do not have symptoms. But for those that do start to have symptoms, they may experience swelling, fatigue, and nausea. Those symptoms are pretty common across a lot of different things. So
they are.
I can easily see someone who's not going to the doctor, so you don't know what your GFR is, just thinking, I'm a little tired, and maybe I get a little swollen when I eat some salt.
Always related to salt.
And maybe I get a little nauseous, but I'm okay, right? So this is why you have a bunch of people walking around that don't know that they have any form of chronic kidney disease. Then you have stage 4, which is a GFR between 15 and 29. This is severe loss of kidney function. At this point, your symptoms, again, might be nausea, vomiting, itchiness, and trouble concentrating. So at this point, the uremia has started to build up in your body. So that's why you might have the trouble concentrating, because like we said, the toxins go everywhere. That includes your brain. So you might have some confusion, some irritability even.
Yeah, like
brain fog. People get really annoyed with others, just a whole bunch of stuff. And again, a lot of these symptoms you could easily pass off as being part of something else or just like one-off things, especially if they're not really happening consistently. Stage 5 CKD is a GFR of 15 or less. So, or less than 15. That means you have very little kidney function left. Your symptoms will most likely at this point include swelling, itchiness, decreased appetite, mood changes, because the uremia is just building up and you're irritable, you are not having it, you could be sad, right? So like we said, the kidneys are responsible for properly utilizing the vitamin D that your body is getting. If your vitamin D is also very important in regulating your mood, in case you guys didn't know. So that's not happening at stage 5. Nothing is right. And so it's usually at this point where people start to kind of notice some things, and they're like, something ain't right here. Let me go on down to the hospital, because you could have fluid built up to the point where you can't breathe or you're short of breath. And that's usually what prompts people to go to a hospital.
Yep.
Honestly.
Yeah.
When my dad was going into having kidney issues, he had diabetes and hypertension. He was not managing them whatsoever. He was just eating whatever he wanted, being stubborn, not really going to the doctor like he was supposed to. And what prompted him to go to the hospital each and every time was he couldn't breathe. The fluid was just so much where he felt like he was drowning internally. That's what it feels like. I can't really speak on what it feels like, because I never felt it, but that's what it's described as. Yeah. And he would always have to have emergency dialysis to get it off, and go back.
So did he have like a regular dialysis schedule? Rather than just the emergency dialysis?
He would have had it if he would have been compliant, but he moved back to his country, and
they didn't do dialysis there?
They did, but he wasn't having it.
Okay.
So at that point, when you're at stage 5, you are in
sorry, I keep going out.
You are pretty much in end stage renal disease, or what they call ESRD. Some places call it ESKD.
Really? I've never heard of it as such.
Yeah, I just saw that the other day. I'm like, okay, because I guess the word renal, some people don't identify with it, but renal is the kidneys. Okay? At that point, really your options for sustaining life are dialysis or kidney transplant. So, 2 things I take from this, and I'm saying 2, but it may be many more. You need to be going to your doctor so that you know what your GFR is, okay? Because we don't get to any of this unless you know. Because as you can see, you may not start to feel anything until you're in stage 5. And at that point, your options are 2 options. Well, 3.
3.
Girl. 3 options.
Mm-hmm.
Dialysis, transplant,
or death.
Go to glory.
Mm-hmm.
That's what it is. And
you don't want any of those.
You don't.
What's so unfortunate is that we all, those of us who do go to our PCPs, like me, I only go see my PCP once a year for my annual physical, right? I would go to him if I wasn't feeling good, but 9 times out of 10, when I have an issue, it's always on a weekend for some strange reason, and I go to urgent care, who my PCP is affiliated with. But I really don't go to my doctor. I go once a year for an annual, and that's when he does blood. I am going for blood next week again, though, because my B12 and my iron was low. So I'm going 6 months later for more labs.
Okay.
But that's not normal.
Yeah.
So even for those of us who do go to the doctor annually and get blood work done, we're still living la vida loca.
But not as loca. So you might catch it earlier, because he does order that test. So,
but what if stuff don't start popping up until after I done got that test? Then we won't find out till the following year, unless you don't feel well. If you don't feel well, if you just feel blah, and you have some of these symptoms, you should definitely go get it checked out.
Yeah, that's the thing. The symptoms are so insidious that, again, if you're not hypochondriacs like us, which I'm a hypochondriac, so the situation with my son is very surprising, because everybody missed it. But the people that should have caught it did not. That's a different story. But to us, a lot of the 3 symptoms that he had were not things that we thought were ever connected, and also could have been, we actually kind of explained them away for other things. And, God knows why he made everything happen the way he did, but what I will say is that his story is not unique, unfortunately. I have come across so many people on TikTok or YouTube or wherever. Well, not so many people, but those who are younger, right? Because I feel like those are the ones that get missed. Mm-hmm. Because you don't expect for a young person's kidneys to be failing. You just don't. The pediatricians focus on them getting their immunizations. They want to make sure they're developing, hitting their milestones. He never missed a milestone. He's like, if anything, he was very extra with everything. And so you're thinking, just a kid. Like, yeah, he doesn't, whatever. No. And we've even said it during our episodes, right? If you know, or if you have a symptom, even if it's one symptom, where you feel like it is uncharacteristic for you, look into it, because you never know. You just never know.
No, that's very true.
Okay, so dialysis options. So there are two types of dialysis. There's hemodialysis, which deals with a machine that has an artificial kidney that, and then how you have tubes that come out of you, and it removes the blood from your body over a course of a few hours, depending on your prescription, and the artificial kidney on the machine cleans it and it returns it back into your body, good as ever. It's a miracle, really.
You normally feel better after getting dialysis.
Yeah, because all those toxins were building up, and yeah. You can do that either in a center or you can do it from home now. Hemodialysis. I'm like, oh, okay, that's wild, but look at God.
That wasn't an option back when.
I know, right?
When did that become an option?
Probably after COVID, or maybe before. I didn't know about it. But tons of people love it because you could just, you hook yourself up. You spend a few hours on it, unhook it.
Hemodialysis?
Hemo.
I've only known about one type of at-home dialysis. That's crazy.
Mm-hmm. So you can usually people have it 3 times a week. So you'll have it like Monday, Wednesday, Friday for 3 to 4 hours at a time. So you get hooked up, you get a blanket, chill, go to sleep, whatever it is you want to do, you do it for 3 to 4 hours, go home, live your life, go back on Wednesday. And you do that for however long. I know I've heard some people have been on dialysis for 20 years, 30 years. You can really, it's acting as your kidneys. It's functioning as your kidneys. And then there's peritoneal dialysis, which deals with fluid. It's like a dextrose-based fluid that gets, I won't say installed, but it gets put into your peritoneal cavity, which is your abdomen. And you go through cycles of filling yourself and then letting it sit so that it can suck up all the toxins. And then you drain it, and then you repeat that process for however many times that your body requires it. So everybody's going to be different, just like hemo. Everyone's going to have a different prescription.
Question for you, for the audience. You said that it pulls fluid from the abdominal cavity. Mm-hmm. How does that happen? Is there something implanted in the abdominal cavity? Yes.
So in order to have any one of these forms of dialysis, you need to have some sort of port. So for hemodialysis, you would either have a fistula or I think they call it a graft or something.
Is what we call it in the clinical streets.
Okay. So you'd have some type of connection to connect the machine to drain the blood and bring it back. So there's two thingies that connect. I don't know, say thingies, whatever they're called, Kim. That one is for the blood leaving your body, and the other one is for the blood coming back in, for the clean blood, so dirty clean, whatever. And then for peritoneal dialysis, you have to have a peritoneal dialysis catheter placed in your abdomen. So that looks like a
I've never seen what that looks like.
Oh, well, Omar can show you. Yeah. But it looks like a little marker, and it's a tube, so a catheter, and it's installed there. And when you get it installed, you have to wait, like, they say about 10 days for the scar tissue to form around so that it's anchored in your cavity. So that once you start filling the peritoneal cavity with fluid, it doesn't, like, burst and come out of place. So the catheter is installed in the peritoneal cavity, comes out, and they make sure that it's working, that there's fluid that goes in and can come out. They flush it. So a few days after it's installed, you go get it flushed so you make sure it's working. And working means that they can insert fluid and that the fluid comes back out.
And that's a form of surgery, right?
Yes, that is a surgery, and it's not for everybody. So if you've had prior abdominal surgeries and you may have some scarring in your abdominal cavity, it may not be a good choice for you, because then the fluid really won't work for you. Because the idea is that once you're hooked up to the machine and the dextrose solution goes into your peritoneal cavity, it acts as a sponge to pull in all the toxins. Everyone's peritoneal cavity is different. Some people have think of it like a tennis racket, maybe. So some people have a tennis racket where the mesh is maybe wider. Oh, okay. So the fluid can get in and get out quicker. So it's getting in there and it's getting out. But some people that have smaller grids, I guess, in the cavity, and so it's harder for the fluid to get in, and it's harder for it to then suck in all the toxins and then get out. So that's the difference between a low transporter and a faster transporter of
Where does
toxins. He's a low transporter, which we just found that out last week.
Okay.
So when you're a low transporter, that usually means that you benefit from the fluid sitting in your cavity for a longer period of time.
So it can absorb.
So that it can absorb more of the toxins, as opposed to a shorter time of it dwelling where it doesn't have as much time to get it in before you flush it out. Because over the course of how many ever hours you're hooked up, and again, it's different for everybody, you're going to go through different cycles of the solution dwelling and being drained, dwelling and being drained. So that is how that goes. And it takes a little bit of, reconfigurations to figure that out for each person, right? Because you can't assume just because someone is so young, again, that they're going to be a quick transporter. No, it's all about how your body is set up. And we don't know that really until you start doing it. So either one of those types of dialysis are options. They also mentioned like this nocturnal hemodialysis where you can go to certain centers, it's available, and you just get hooked up overnight and you sleep for during
like
hemo.
Like a club for hemo?
Right, the hemo club, everybody.
I've never heard of that either.
Welcome to the club. We all say
So DaVita offers that?
I don't know who offers it, but it's offered somewhere. Probably for really rich people that can't get the kidney off the black market. I'm just saying. All right, so that is the gist of kidneys, their function, the stages of CKD, the treatment options. Now, I will say we listed some of the symptoms, but let's just reiterate those really quickly. So if you're experiencing any of these symptoms, and they don't have to be all at once, because to be quite honest, probably the reason why probably a lot of people don't recognize that they have this is because maybe they'll have swelling one time or a few times, and then they'll have frequent urination another time. So one of the symptoms, I will say, of early kidney like dysfunction is frequent urination. to the point where you have to get up in the middle of the night and use the bathroom. That is one thing that I noticed that a lot of people said they had, and they kind of wrote it off as maybe they drank too much water or something was going on. And I will say that is one of the symptoms that my son had. But he had always been a thirsty boy. Like, he would drink so much. And we just thought, I honestly thought he had diabetes. So we had kind of started to go down that route a little bit. But he was urinating a lot, like to the point where he would have to like get up and go to the bathroom in the night a lot. And sometimes where we would be out and we would get in a car. Let's just say that trip was more than an hour. He'd be like, "Oh, I gotta go to the bathroom." I'm like, "Why can't you hold?" I just thought maybe he had a small bladder.
And this was early on?
Yeah, this was probably like a year before. Okay. Again, kind of chalked it up to
he drinks too much.
He drinks too much. A lot of things in our life was changing at that time. So the nighttime issues we thought were because of all those changes, like emotionally. And they can very well cause things like that. So that was one of the things that he did have that we noticed. Another sign could be the swelling. Never noticed any swelling in him. So that wasn't a thing. Mm-hmm. But if you have swelling in your feet, your ankles, your legs, you want to check that out, right? You can also have swelling in your face. So under your eyes is a common place for that to be. Mm-hmm. Doesn't have to be too prominent either. It doesn't have to be like big bags under your eyes or anything. It could just be some swelling underneath the cavity of your eyes. Or in your face, like your cheeks. That's where you're going to see it a lot of the times. Feet, ankles, legs, cheeks, under eyes. Big time.
Did you see that in him?
No.
Okay.
Nope. Mm-mm. The swelling for him didn't really happen until we got to the end. Like, yeah. Another one is if you don't already have hypertension, high blood pressure readings. Mm-hmm. So in this journey, we've talked to a lot of the pediatric patients, and their first clue that anything was wrong with them was because they happened to go to the doctor and their blood pressure was high. And they said, that's not normal for someone of your age that doesn't already have hypertension. Mm-hmm. Let's check your urine. And then they notice that there's protein in their urine, mm-hmm. and then they realize that something's going on with their kidneys. Mm. So 9 out of 10 times, the younger folks, if they don't know about it from birth, which a lot of kids their mothers would notice either the 20-week scan or through some type of genetic testing, maybe because they already have some genetic kidney dysfunction, mm-hmm. that their child is already going to have something going on with their kidneys, or that, I don't know, there's some blockage in their kidneys, or they only have one or something. So unless it's found in the womb or shortly after birth, a lot of times teens and those in their 20s notice it because of elevated blood pressures. And think about it. We're not going around taking 10-year-olds' blood pressures. We're just not. So if you're not going to your visits, your yearly visits, you would never know. You're not in a supermarket just putting your arm. I mean, some kids might do that. They might put their arm in there, and good to know, right? But on average, you're not checking a 10-year-old's blood pressure. You're not. I mean, now I am. I'm checking everybody's blood pressure. Peanut gets a blood pressure check, okay? Huh? Send his kidneys. Are your kidneys working okay, Peanut? We need to know.
His BP is a little low
right now. I'm side-eyeing him as well. I'm like, you got hypertension. We're going to give you some of this enalapril, okay? But for real, though, this has turned me into kind of a little bit of a psycho.
As it should.
with people. Everyone around me could get it. You get a blood pressure reading. You get a kidney check. You got stones? I'm looking at you too. Okay? What other symptoms could you have? Nausea.
You did the nausea yet?
Nausea, vomiting.
We said headaches. Sometimes because of the high blood pressure and the headaches, you can have blurred vision. Just a feeling of like malaise, like
fatigue, shortness of breath.
Just like you just don't feel good. You just don't feel like yourself.
Yeah.
You feel like you're full of toxins.
Yeah. Or whatever that feels like. Shortness of breath. Because if you start with the fluid build up, some people never express it in the way of swelling anywhere. It builds up around your organs sometimes. So then you have the shortness of breath because you're drowning internally.
Yeah.
So it can express itself in that way too. It just could be so different for everybody. So there's really, if you're experiencing any of these symptoms, it's important to know what your numbers are because you won't know if you don't go to the doctor. You won't know. And then, unfortunately, some doctors will run the tests and they'll tell you, oh, you're good. Don't accept that as a response. Know exactly what your numbers are. Know exactly where you stand with all of this. Do your research. And I've heard stories of people not finding out until they're in stage like 3 or 4 because when they were in stage 1 or 2, they had been going to the doctor like they were supposed to, but their doctor kind of brushed it off as, oh, you're good. No, we don't accept that.
Get your labs.
Get your labs, look at them, do your research.
Google.
And know exactly what's going on. So, that's what I will say. Anything else about anything they can do?
Well, I'm up to the part about changing the diet. You already said that, right?
Yeah. So during the earlier stages, if your kidney disease is caused by something like hypertension or diabetes, like I said, there are things that you can do at that point, right? You can make sure that you're managing those conditions. If you have both of them, make sure that you're taking your medications, you're keeping your blood sugars in check, you're keeping your blood pressure readings in check, you're taking those medications for that condition. That comes with looking at labels, looking at your sodium intake, looking at your sugar intake, right? Managing it through diet, managing it through exercise. You can hold strong in a certain earlier stage for quite a while if it's due to something hypertension and diabetes type 2 related causes. You can hold strong if you know about it. You can try to either get yourself back down to a certain stage or stabilize at that stage and never get into the end stages of kidney failure if you know and if you make the changes to do that. Now they're saying Ozempic can help with it too.
Oh, really? Says here that you should quit smoking because nicotine raises your blood pressure and puts stress on your kidneys.
Oh.
Yeah. And it says avoid NSAIDs because I'm not sure if you guys know, but acetaminophen, which is Tylenol.
That's how you say it?
Mm-hmm.
I've been saying it wrong my whole life.
How have you been saying it?
I've been saying acetaminophen.
You can say it that way too.
Oh, okay.
Yeah, it's fine. It metabolizes through your liver, and any NSAIDs metabolizes through your kidneys. So if your kidneys are already compromised, you want to stay away from things like that. And NSAIDs also increase your blood pressure. So if you have high blood pressure, you should not take NSAIDs.
Oh, so NSAID stands for non-steroidal anti-inflammatory drug. Yes, look at that. And that includes Motrin, Aleve,
Advil.
Ibuprofen. Aspirin. Tramadol. Am I making that up? I don't know. But you probably won't have that. But those are all the over the counter. Which is Aleve.
No. Naproxen is the main ingredient in Aleve.
Okay.
Yeah.
Just like Motrin is ibuprofen.
Yeah.
These are just brand names. Like Kleenex is a tissue.
Wait, what?
Pampers is a diaper. Band-Aid is a bandage. Need I go on?
Oh my God.
I mean, these brands become synonymous with the product. So much so that we think that's the name of the product, but it's not.
Oh, here's some of the stuff.
Ooh.
Well, you already said that. Trouble sleeping?
Yeah, trouble sleeping because of the toxins building up in your brain, so you can have insomnia.
Having angry outbursts.
Personality changes.
Yes. Oh. This takes us back to one of our other episodes where we said therapy would be good. If you are diagnosed with something like this, like end-stage renal disease, it's life-changing. Excuse me. Even if you get a kidney, that too is life-changing. Your life will never be the same exactly because of what you have gone through and what you're going through. So therapy would be
recommended.
Yeah.
Critical, even.
Are you going to share your story?
Yeah, we're ready. Just ask me questions because at this point, I don't know. I don't even know what to say. But you up here reading these people's book in our video, and I don't want to get in trouble.
Oh, I don't think they can see that, can they?
Okay, I don't know. That's fine.
Maybe you want to tell them what symptoms Omar had that made you go to the doctor.
Okay, so during the middle of December, he was vomiting a lot more than I care for because I don't deal with vomiting from myself or anybody else. I'm like, child, go over there. But what really made me feel like it was a little bit extra was because, kids throw up all the time. Mm-hmm. Like I had 2 other kids and they always throwing up from something. My head hurts. I licked the seat of a bus.
Whatever, and then put it.
Right. You know what I mean? They be out here doing wild stuff and picking up all types of viruses and just throwing up, right? Mm-hmm. Getting everybody in the house sick. So, when I noticed that, he would throw up, but my other 2 wouldn't be throwing up, I'm like, okay, it's not a viral thing, but it could be because he's in a completely different house and school district. So it could have been. But it was a frequency at which it started to happen with no real cause to me. So I, at that point, started to research pediatric gastroenterologists.
Oh, yeah, I gave you Corey's.
Kim even gave me Corey's because I'm like, girl, I need to take my child to the pediatric GI. He has Crohn's, he has IBS, something's going on. He got a food allergy, something going on. So it got to a point where it started happening back to back, and I was like, I can't wait for that. I need to take him to urgent care. Took him to urgent care near my house. Waited quite some time. Got back to the room. They were not even going to do vitals because he's a child, and I told them why we were there. And I guess they didn't feel like, they were going to do like maybe a temp and a pulse, but they weren't going to do a blood pressure. And I was like, please do it because I just want to know everything. They took his blood pressure and it was like 170, 150 over something.
It was something crazy.
So she's text me. Yeah. So she took it with the automatic cuff and got a very high reading. And the girl was like, "Oh, that's not right. That can't be right. Like this cuff must be broken," which is what happened to us a few months before that at his annual visit. So usually when that happens, they feel like someone has white coat syndrome and they're just nervous. And they usually retake it with a manual cuff because that will give you a more accurate reading. You're not relying on a machine. You don't know if that machine is like malfunctioning. So she retook it with a manual cuff. And mind you, everybody doesn't know how to take blood pressure. So I will tell you, they'll listen to them clicks and clacks and air, and they'll be like, oh, it's 124 or whatever. And honestly, I feel like they do that and they think because it's a child, like, yes. And Omar is slim, tall, didn't look like anything was wrong with him other than maybe being fatigued from throwing up a little bit and maybe a little dry and dehydrated from that. Other than that, you can't look at him and say something's going on with your kidneys. Okay. She takes it with the manual one. She's like, it's still high. I'm like, okay. Doctor comes in, very nice doctor. I actually need to go now that I'm saying this. I need to go write him a review because I went back to thank him for saving my child's life.
Oh, did you go back?
I did go back.
Did you see him?
I saw him. I requested to see him and speak to him, and I told him, I'll tell you.
Oh my God. I didn't know
he
that.
said, this is not right that his blood pressure is even in the manual one, that it was still elevated. He's like, let me get a urine sample so we can do a dipstick. Did the urine sample. He came in after the urine sample. He said he has a lot of protein in his urine. He said something is going on with his kidneys. He said, I don't know what, but something's going on.
And he wasn't a pediatric doctor, but he knows that something's going on with his kidneys because kidneys be kidney, and no matter who they
it
are,
is,
right?
We don't care. Kidneys do not discriminate. Okay. So he said we're gonna do labs because he wanted to make sure he did a CMP. This is important because a lot of times in kids they don't order CMPs. They will just order a CBC.
They don't.
Okay. If you suspect anything, you want to have them order a CBC and a CMP because the CMP is going to give you the kidney function test, and it's also going to give you some other stuff too, but it includes the kidney function as well. If you just get a CBC, you may be tipped off if the kidney failure has reached the point of anemia, because the CBC will tell you your hemoglobin, right?
Yep.
But if it hasn't reached that level, you won't be tipped off, and you won't know anything about the kidney function, period, because the CBC won't tell you that. So just a little tidbit right there. So he said, let me get all the labs. Drew the labs, but we weren't going to get the results until the next day because it's not an instant thing. So he said, in the meantime, I need you to follow up with his pediatrician ASAP. He's like,
I'm surprised he didn't send you to the ER though.
Me too.
I really am, but proceed.
He said, I don't manage kids. That's what he literally said that. He said, I need you to follow up with your pediatrician within the next 2 days. I called that pediatrician as soon as we set foot outside. I explained to them exactly what happened. At that point, they should have told me come in now.
What did they say? Come in tomorrow?
They said, oh, you can come tomorrow. So I said, okay. So here I am researching why, protein would be in the urine, all of his symptoms. I'm like, oh, he has diabetes.
You did say that.
Because I'm thinking he's so thirsty all the time. He was peeing a lot. These are all symptoms of diabetes as well. I got to be honest. So I'm thinking, I don't even think I thought back to the frequent urination. I just thought back to the thirst and the nausea and vomiting and the something else was going on with him at that time. He said something with his eye was going on. So honestly, I said, okay, he has type 1 diabetes. We're gonna deal with it. A little insulin here and there. We're good to go. We'll see what the pediatrician says, okay? So I had a whole talk with Omar. I said, son, you might have diabetes, but it's okay. We'll manage it. I said, it's okay. We'll just get a little insulin shot. We'll be good to go. All right? So for whatever reason, my mom was like, I'm going to come with you to this appointment tomorrow because I want to make sure my grandson is okay. And that's really, it's not uncharacteristic of her to care, but to actually physically come somewhere with me, it kind of is, because she'd be like, oh, I'm tired, I work, whatever. But she said, I'm going to come with you. So I said, good, because I really want to, solve this, whatever is going on with him. Whether it's Crohn's, IBS, or diabetes, we got this. Took him to the pediatrician, explained everything. They took his blood pressure. 170, 180,
it was high.
over 100 something. They said, oh. So then they said, oh, well, let's do some urine here too. Took it. They said, oh, okay, we see some protein in here, whatever. At this point, me and my mom had already clinically decided that we were taking him to the ER. Mm-hmm. But they they also said it. And they helped us to decide which ER we were going to. We decided. They called ahead, so they were already expecting us. Got in there. They had my baby. They had 4 blood pressure cuffs hooked up to my child. 1 on each arm, 1 on each leg. Mm-hmm. All of the blood pressure is sky high because now he's nervous. Yeah. 190 something over 1 something. 200 over 1 something on the legs. I'm in the
about to have a stroke.
I'm in the corner like, and he's over there looking like, what's happening? He doesn't understand what's going on. So now it's a rush to bring it down, but also to understand what's causing it. So they come in, they do some blood work. Again, I'm still thinking
the sugars,
and he just got hypertension, like the salts. After they sent the labs over stat, I guess they had to like confirm them because the numbers that they saw were ridiculous. Numbers that they've never seen before, to what I was told. In an adult even, much less a pediatric patient. So we're all sitting in the room, chopping it up. I'm like, yeah. The doctor comes in and she just looks her face just blank.
This
and
is
I'm
still
like,
in the ER.
Mm-hmm. She comes in and she's like, she starts asking me a few questions. I'm like, I don't like the questions she's asking me.
What the hell she asked?
I don't even remember what she asked. But she comes and she says, at that point, she's like, we don't have all the blood work back because I guess they were rerunning some of the factors to confirm that they were actually that high. She comes and she goes, I don't want to tell you a diagnosis or anything because we don't have all the numbers back yet. She's like, but what I do know is that his hemoglobin is really low. She told us it was like 6.6. She's like,
he needs a blood transfusion.
She's like, we need to get 1 more tube of blood to do a typing screen because he needs a transfusion. I said, oh God. So now I'm spiraling because I know none of this is good at this point. So I'm thinking cancer. Mm-hmm. So combined with what the doctor said the day before, he's like, something's going on with the kidneys. I just don't know what.
So you thought kidney cancer because
immediately
you told me.
Yep, I said. So now I'm on my phone looking up kidney cancer.
You gave me a few diagnoses that you had diagnosed him with.
Yeah, I did. But I left the room where he was with my mom. I went into another room, started looking stuff up, but I immediately started crying. Mm-hmm. Broke down completely. I said, I called his dad, and I said, look, he was working. I said, I don't know what's going on exactly, but I know it's not good. How fast? Like, where are you? And I need you to understand that whatever this is, it's serious and it's not good. Mm-hmm. I said, I don't know what it is, but I know the look on someone's face when it's not good. As I was saying that, and as I started to kind of cry, the doctor found me. She's like,
she came looking for you.
Yeah, she's like, can we go in another room? I said, oh shit, this is definitely not good. So I'm on the phone.
So you kept him on.
I kept him on the phone so you hear it. So we go into the other room, and she's like, I really don't know how, to really say this, but
what?
she's like, I need to confirm with the nephrologist in-house. She's like, but based on his levels, he is in kidney failure. I said, excuse me? I said, what? I said, kidney what? Not just they're damaged a little bit, they're failing.
But at this point, you didn't know if it was acute or chronic.
Right. So
and she didn't either.
She didn't either because she needed the specialist to confirm that, right? Because everybody, you can just be you can be a general practitioner, but when you specialize in something it's going to be an organ or a system, right? Mm-hmm. So it could either be, nephrologists or kidney doctors, cardiologists or heart doctors,
respiratory,
endocrinology. All of these are very important systems and specialties. And if you specialize in them, you know what it is. You see the numbers. You know what to look for. So she needed the nephrologist to look at the numbers and like see how bad it was. So she was actually crying. Like I can tell she had either just cried or she was like on the brink of it. She had to, when she came to tell us about the hemoglobin, she was damn near in tears. Her voice was shaking. Her face that's how I knew it was something like cancer or something. So, when she told us that, I'm just devastated at this point. I'm like, you gotta be kidding me. Here I am thinking this child has Crohn's, IBS, even diabetes.
And you was wondering, like, how the hell did we get here?
Yeah. I'm just like, this is not real life. This is not real life. So mind you, my mom is in the room with him. I'm finding this out on the phone with his dad. And now I have to like try to compose myself in order to not alarm him. So I stayed out of the room for a long time until I could cry, go to the bathroom. My stomach started to hurt. Because at this point, I'm like, oh, hell no. Like, I need to evacuate the premises. Like, nah, this is not, or whatever. But now I'm like, okay, it could be acute. And maybe he had a UTI. He never said anything. And this whole thing is worse. So I'm like, okay, let's just, take it one day at a time. I don't know what the actual numbers are. I don't know what the case is. We'll figure it out. Either way, though, they knew that he needed to have dialysis immediately based on the numbers and the levels that he was at. So I don't know if you could look it up, but one of the kidney markers that they look at is called a BUN. So that stands for a blood urea nitrogen level.
What was his level?
And for normal levels are between 7 and 20 in kids, 6 and 20 in adults. His was 150. Okay?
Say it again, just in case they didn't hear you.
His was 150.
And 7 to 20 is the normal level.
Yes.
That's insane.
Creatinine is also another number that they look at this point. The normal levels for that, sorry.
I don't remember the levels.
The normal creatinine levels are between 0.74 and 1.35 for men and 0.59 and 1.04 in women. His was at about...
Wasn't it 60 something?
Somewhere there.
It was somewhere really high.
I think it was like 22.
Oh.
Or maybe higher than that. Honestly, I don't know.
I don't remember.
No.
I know that you kept a log and you was telling me.
It was higher than that.
The numbers every day.
So when the nephrologist finally came down to speak with us, very nice. He said, these are the highest levels I've ever seen in my career. And he looked pretty old. So that scared me. Because I'm like, if you're the highest levels you ever seen, look like you done seen some numbers. So you tell me, my little child that I only thought had IBS, Crohn's, or diabetes are the highest levels you ever seen. Either you haven't seen a lot of levels or this is really bad. So he's like, oh, he needs to have a shunt placed and he needs to have dialysis right now. So that's what happened. Got rushed back to have it placed. And actually, they could not do the dialysis like that day because his hemoglobin was so low.
They had to work on that first.
They had to work on that first. So he actually had to get the transfusions first, get his hemoglobin up to at least like 8. And then the next day is when they started.
So what you're saying to me is that he had to have a life-saving blood transfusion before he had life-saving dialysis.
Yeah.
That's crazy. That is so crazy. You have learned so much doing this. Like I said, you have educated me multiple times on things that I did not know. But can you just share with them how long he was in the hospital?
Okay. So from the point that we got there, it was a Thursday. He was in the pediatric ICU for 2 weeks.
So he went from the ER directly to pediatric ICU.
Yep.
Was it only 2 weeks?
It was 2 weeks.
That was the longest 2 weeks ever.
The longest.
I thought it was like 3 weeks.
We spent Christmas in the hospital. We spent New Year's in the hospital. And he got out right after New Year's.
And you said that you saw so many kids and families come and go.
Yeah. Like, get admitted and then discharged. Either maybe they stepped down to the normal peds. I don't know what they did, but he couldn't leave that unit because he's on dialysis. It's you have to be monitored closely. And he was actually their first pediatric dialysis patient. So they said his name's going to be in the history books. I said, oh God.
That's crazy.
I'm like, okay.
Can I just ask you, what do you feel like you learned from all of this thus far? Because you're still going through it.
Yeah. I learned that our bodies are amazing. I learned that God is great. Well, I already knew that, but it really forced it. I learned that everything happens for a reason when it's supposed to happen, I guess. I can only, believe that. I learned that you really can't brush off certain symptoms. And that you have to, it's hard because, like I said before, a lot of these things were kind of explained away as other things. But hindsight is 2020. And thinking back to some of them, a little bit more digging by anybody would have caught this sooner. And I think about, would it have changed the outcome of it? No, because what we've ended up finding out is that this is actually something that he was probably born with. It's a genetic issue that we wouldn't have known about.
Congenital.
Yeah. But some of the impacts of on his other organs right now probably could have been either prevented or lessened if we would have known about it before. Because it went on for quite some time, it caused damage to other organs. So,
do you want to elaborate or no?
Not really.
Okay, all right.
No.
Okay.
I mean, your kidneys work in tandem with your heart. So when your kidneys don't work and that persists for a little bit, your heart starts to overcompensate for it. Mm-hmm. So that's pretty much what is happening with him right now. And so he has decreased heart function. It's common amongst renal patients, but it's definitely something that probably could have been avoided or not have reached the level that it's at now if we would have caught the renal problem sooner. But like I said before, I really, really thank the urgent care doctor because he did take that extra step. And it really wasn't a big thing to say, the blood pressure really shouldn't be that elevated. Let's take a quick urine sample. Something so quick that he did that changed everything. And I just wonder why that wasn't done by the other doctors before when they got the elevated. Because it's nothing to rule it out.
Mm-hmm. Yeah, definitely. Well, I don't think I have any other questions for. Oh, do you want to talk about the transplant journey, or no? We'll save that for after.
I feel like that could be an entire episode, and like I also feel like some of these things can be entire episodes if you guys are interested in that, because quite honestly, it is a huge thing. And so um going through the process and just like trying to get to the transplant list has been a journey. I'm like, wow, I never knew it took all this. Like Grey's Anatomy made it seem like you just go in, you go to so you bring the little organ in the cooler, and we're good to go. Come on, Grey's Anatomy, do better. Okay, you skipped this.
They came back on Thursday. Did you watch it?
No, I haven't watched that thing in a while. I just started watching it again. That's why he looked at me like that. But Angie Stone just passed away in a car accident, but she needed a kidney transplant prior to.
She did?
Mm-hmm. So she was talking to, ain't that some shit? You do all this shit to get on the list, and you die in a car accident. I mean, come on.
Oh my God.
Well, no, she can't. Well, but before
she needed a kidney.
Yeah, before she passed away, apparently she was texting with Albie Shore, which is like very random. And they were texting about how she had some people in line that wanted to like donate, and they were just, it's really hard to donate. They make it really hard because they want to make sure you have to be in like pristine health in order to give your stuff. At least that's how they make it seem.
Wow, that's so crazy.
But
I never knew that.
She was texting him back and forth saying that it's racist and they make it hard.
Do you feel, well, you do feel like they make it hard because you're going through it.
Mm-hmm.
Did you get that racist part?
I didn't so much get the racist vibe, but based off of some of the information I was told today, there is a key component, and it has to do with a gene that people of African descent have, right? It's called the APOL1 gene. And if they do like really extensive genetic testing on you, if you want to be a donor on that gene specifically, and they find anything that where your kidneys are anywhere in the line of possibly being damaged in the future, then you can't donate it. And so if we are the ones that have that gene and they do it, then we can't donate. So I can see what she means by that.
Yeah.
Because of that, it's going to make it harder. And it's going to take you out of the running. So even if you want to, you can't. They won't let you.
Have you done research on the statistics of Black children receiving kidneys?
No. Because the recipient doesn't matter as much as the person that's giving it. Yeah. All that matters for the recipient is that the blood type matches and the tissue cross match. It's fine.
That's the whole donor.
Yeah, the donor just can't. So if you have a living donor, they're going to test the crap out of you. And they're going to make sure it's perfection. Because you're living. Like, and what's the rush, right? If it's deceased, on the other hand, it doesn't go through as much rigorous testing. It just has to be a match. So that your body doesn't reject it.
The chances are better with the dead kidney.
You mean the chances of what?
Of actually
getting one. Yeah. It's going to be probably quicker.
You're open to both.
Yeah. Come on. Send us kidneys, Lord.
That's all I got, which I didn't have much. You had it all.
You had some stuff. You brought up the NSAID stuff, which I forgot about completely. So yeah, if you're in those earlier stages, you want to avoid taking NSAIDs. You want to reduce that. You want to drink a lot of water. You want to make sure everything's flushing out. One last thing that I will say is that over the course of the next few months, and this month being National Kidney Month, I do plan on providing everybody with a link in this video so that you can, if you are interested in signing up to be a living donor, even though we just talked about how hard it is, I'm going to provide a link where you can fill out, you can answer some questions, right? So some preliminary screening questions to see if you're a good candidate to come in for further testing so that you can see if you want to donate your kidney to Omar. So that would be a directed kidney donation. So that's you saying, I know him, I want to donate my kidney to him. Let's see if I'm a match. If you become a match, they'll set the transplant up. Then there's also something called altruistic directed donation, where you don't really know him, you're not related in any way, but you want to donate, right? And in some cases, if you're a match, you can directly donate to him, right? If you're not a match, in some cases, you can do what I've seen, which is like a swap. So if you donate altruistically in his name, then once they do find a match for him, he'll get that one. So it's like you kind of like, it's like a voucher.
Skip people. Wait, huh? What?
So let's say you want to donate your kidney, right? But then you go through the testing and you find out, and you want to donate it to Omar. You find out that you're not a match, but you still want to donate it because you want to do that altruistically. That just means you want to do it out of the kindness of your heart. If you do that in his name, there's a way that you can do that. And then if someone else does it, maybe like a ripple effect or what have you, he will then get the one that matches him.
Even if he's way down here on the list and there's other people before him?
I don't know all that. I don't know how it works, but it's a swap somehow. Okay? Kidneys are getting passed around left and right. Left and right. Kidneys. You get a kidney. You get a kidney. Oprah's giving out kidney. Somebody's getting a kidney. Okay? All right? Okay. It's a kidney voucher. Kidney food stamps. I don't know.
Kidney food stamps? Well, the president is about to take those away, so we don't want to call it that.
I know. Well, whatever it is, his blood type is O positive, so that's a start, right? So if you know that your blood type is O positive, we can start there. The tissue type does have to match as well, though. But if you know that's your blood type, that's where we start. So I put the link and
I feel like you should also do something on TikTok or something.
I will. I'll be doing something on all the social media platforms. I'm going to have the Living Donor organization help me put that together.
Yeah. Okay.
Some people do billboards. I might put something on the side of my car. I don't know yet all of what I'm going to do, but
a billboard would be nice. Okay.
So we'll see.
All right. That's it, Jazz?
That's all she wrote, unless you have more questions, Oprah.
I don't have any more questions.
Okay. All right.
It's tried, fried, and laid to the side.
I know. Well, thank you guys for tuning in.
Tune in next time for more snitching.
Bye.